No cause of death has been determined for actor Michelle Trachtenberg, whose body was found on Wednesday at her Upper West Side home, according to the New York City Chief Medical Examiner's Office. Trachtenberg, 39, had recently received a liver transplant. It is not known whether she suffered complications from that surgery. 3 doctors who research or treat liver disease said that complications, such as infections or blood clots, are somewhat expected after a transplant, but patient outcomes are generally positive. The 5-year survival rate exceeds 75%. Typically, by the time that someone is leaving the hospital, there are usually all indications that the liver is working, said Dr. Danielle Brandman, medical director for liver disease and transplantation at NewYork-Presbyterian and Weill Cornell medicine. Some serious complications that may arise after surgery include heart attacks and breakages or clots in the arteries or veins where the new liver was attached, which can lead to liver failure. In other cases, medications prescribed after surgery may generate high levels of potassium in the blood, causing irregular heartbeats, said Dr. Elliot Tapper, an associate professor of hepatology at the University of Michigan. This is one of the most involved surgeries that can be done, he said. People are sick afterwards. They're usually weak or they've had an infection or some minor complication, and they'll need somebody to help them with their activities of daily living. Transplants are typically reserved for people whose livers have sustained irreversible damage, leaving them no other options. Around 10,000 people receive liver transplants annually in the U.S., and 24,000 are on a waiting list at any given time. The reasons Trachtenberg received the transplant are not known. Nationwide, alcohol-related liver disease is the most common reason for a liver transplant. Around 41% of recipients in 2023 had alcohol-related liver disease as their primary diagnosis. Fatty liver disease, a condition linked to obesity and diabetes that is characterized by fat buildup in the liver, made up the second largest share, 20%. Other, less common reasons for a transplant include liver cancer, viral hepatitis, and autoimmune conditions.